Hello, today we will look at the subtypes of unipolar depression. This will be a very similar video that we did when we dealt with symptoms, but it will be more focused on the subtypes of depression, and it will be very important to distinguish these subtypes to differentiate people with depression, because not all the symptoms are dissimilar for all patients of depression, and therefore it's very important that you recognize that there exist many different people with many different subtypes of depression. And the subtypes are anxiety, atypical, catatonic, melancholic, mixed features, peripartum, psychotic, and seasonal. So anxiety, this is something that you already know intuitively by knowing the word anxiety. You have felt anxiety in your life many times, but that does not mean that you have depression. Anxiety is a normal human emotion that is present for all the people in the world. But in this disease, we have a depression with very high level of anxiety, meaning they are afraid of many things, and they are really afraid of many things. It's not just that they are afraid a little bit, they have an anxiety personality that is actually the most focused, most typical symptom of this depression. So you will think that depression usually comes with somebody being sad. That is, of course, the normal, typical patient with depression. But actually, there exist people with just anxiety, really hard anxiety, and you would then group these people into anxiety disorder, but actually maybe these are people with depression with anxiety. It's not in the opposite way. They are not people with anxiety with some depression. They're actually people with depression with high level of anxiety. And the symptoms of anxiety depression is worrying. They are worrying constantly. They have rumination, meaning they are thinking about the same things in their mind. They cannot really come out from this thought. They don't come to a conclusion. They just circle around the same thoughts again and again. Health anxieties, hypochondria, so hypochondrias, panic attacks. This is typical when you have a high blood pressure, you're sweating, you have a really high anxiety, and then you get an attack, okay? You're completely panicking about your situation. And this is very common, actually. Hand wringing. So you're fidgeting with your hand, you're wringing your hands, you're constantly showing anxiety symptoms. So these are the things that you should look at when you think of anxiety. How many patients do you think of all depressed people have anxious depression? Actually, 50%. So which subgroup is then the most important one to recognize? This one. It is comprising half of all depressed people. So it's not a rare disease, okay? The criteria for anxious depression, if you want to look at real DSM-5 criteria, that is a classification system that we have, we should have more than 2 symptoms of tension, restlessness, impaired concentration, fear of losing control. At least 2 of these symptoms. So tension, this is something that you can feel, and the patient will explain that he feels tension in his life. He's feeling like this brain here compressed. He's so tense all the day. Restlessness. This patient is all day long restless. Impaired concentration. The patient cannot concentrate anymore. Fear of losing control, or fear of life in general. Fear of losing control in life, meaning that it can be financial problems, it can be relationship problems. Fear of losing control, and that is an anxious type of depression. Then we have atypical. Atypical is something else. This is something related mostly to eating too much, or we will see what type of symptoms we have. For example, feeling better in positive events. That's pretty atypical, because you would think that depressed people are always sad. But in atypical patients, they are actually feeling good when they have a good event around them, and then they fall back into depression again. So feeling better in positive events. And when you see this guy, you think he cannot be depressed. Yes, he is. It's only that he's feeling better in this positive event. It's a party. He's with his friends, and then he's feeling better. Hypersomnia, sleeping too much. Hyperphagia, eating too much. Heavy limbs, you feel that you're going through the day very heavily. Interpersonal rejection sensitivity, meaning when you have a group of friends, you're very sensitive to any negative comments. Earlier age of onset, this appears in younger age. Family history of depression, meaning that you have this in your family. You can trace it back to your mother or your father or your grandfather or your grandmother and so on. This is very, very common in generation to next generation. Substance abuse. These anxiety, atypical depression are usually drinking a lot of alcohol, they are using a lot of cannabis, or they are using many types of substances that they are abusing. Suicide attempts. These atypical ones can also attempt suicide. Personality disorders. They have different personality disorders, and as we know, personality disorders are very common in people with depression. And anxiety can also be a part here in atypical depression. It's not anxiety depression, but it's atypical depression with some traces of anxiety. And therefore, it's very hard to distinguish these diseases, I know, because they are somehow overlapping all the time. The criteria of atypical depression, when we're dealing with DSM criteria here, more than 3 symptoms, and it has to be a feeling good in positive events, as we said. It has to be an increased appetite and weight gain, so hyperphagia. It has to be hypersomnia with more than 10 hours a day, meaning you sleep a lot, more than 10 hours during the day, also during the night, and so on. Heavy limbs, as we said, you're dragging the whole day out. It's very heavy. It's hard to go through the day. Anger and slightest rejection from others. This is very common. This is the sensitivity that we talked about, that your friends are commenting on your look or on your behavior, and you're so sensitive to anybody commenting on your behavior, on your look, or so on. So it's anger and slightest rejection from others. So catatonic, so we had anxiety, atypical, then we have catatonic. This is a very interesting position that the patient can take up. The symptoms will be hypokinesis. This means slower movement, very slow movement. Akinesis, meaning no movement at all. This picture just showed that this girl is not moving. These patients are very still. They don't do so much. They are catatonic. Mutism, they don't speak much. Stupor, they are actually in a state where it's almost unconscious. It can be, and this is not so common, but it can be a stupor state. Negativism, that is, they are always negative, okay? There's no positivity in their life. Waxy flexibility, this is very interesting because the position of a patient can be like a wax. It means that if you put your hand like this, it will stay like that. If you put like a hand like this, it will stay like that. Whatever you do with this patient, this position will be kept in that position. It's like a wax, and therefore it's called waxy flexibility. Posturing, that is related to this waxing flexibility because they are taking up a very certain position and very strange position. So these people, you have to imagine them like they are not talking so much, they are not moving so much, they are having this waxy shape, they are very slow, and they have this strange behavior, okay? Excessive purposeless muscle activity. This can also be another sign. So they are waxy, but they are also sometimes tapping the foot or wriggling their hand. They are very excessive purposeless muscle movement. It does not make any function what they do, the muscle movement itself, I mean. And then they are staring. So you would look at this patient, and this patient would stare at you. He would be quiet. He would have this waxy. So I would say catatonic is this typical image that you have of strange people. That this typical stigma that you have strange people, that's catatonic. They are staring, they are different, they are very waxing, posturing, and so on. Echolalia, when you say something, they will repeat what you're saying. And this is so strange again. This is very strange. People normally don't do this. Echopraxia, they would do what you do. Of course, this father and son is not echopraxic in that sense, but to illustrate it, the son will do whatever this father do, and this catatonic person will repeat what you say and will do what you do. Okay, and that's very interesting and so scary when you look at it. That was catatonic. This is the strange one. So we had the anxiety, which was 50% of all cases, atypical, which was this hyperphagia, eating too much, sleeping too much, and so on. Catatonic, this strange position. Melancholic, this is the usual type, what you would think of when you think of depression. That would be unresponsive to improved circumstances. Whatever happens in this patient's life, he will not feel good. He's unresponsive. Okay? Just neutral. He got money and who cares? Melancholy, anhedonia, no satisfaction in anything anymore. No parties, doesn't matter, no satisfaction in hobbies, nothing. Psychomotor agitation or retardation, that means that your muscles are either moving too much or too less. So you have too much with this tap, 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 or moving very, very, very slowly. Okay? Cognitive impairment, you cannot think so good anymore, concentrating abilities are impaired. Interrupted sleep, this is sleeping too less. When you compare that to atypical, we had sleeping too much. In melancholia, we sleep fewer hours than normally. Then we have loss of appetite. This is also, compared to atypical, is the opposite. We are eating less and less. In atypical, we are eating a lot. Diurnal variation, meaning in the evening, maybe you are more sad than during the day. Okay, it's different during the day. So most of the cases, there's more sadness during the evening. In which type of patient is melancholia more common, do you think? In severely ill patients and in psychotic patients. Then this melancholia is present very, very clearly. In severely ill patients, so a severe depression, or in psychotic depression, psychosis. Okay? What is the criteria now? Looking at the DSM criteria, more than 4 symptoms, and it has to be a loss of pleasure, like this anhedonia almost, loss of pleasure. Don't feel better in positive events. Don't feel pleasant, this is anhedonia again. So it's very related. So loss of pleasure, don't feel better in positive events. And we have to have 4 symptoms. Severe depressed mood with despair or gloominess. You know, in the night, you're this gloomy. You're listening to music that are so sad. This is the typical depressed mood with this gloomy feeling. Okay? Early morning awakening. You cannot sleep so much, you're sleeping less and you're waking up early. Psychomotor retardation or agitation, meaning either tap, tap, tap or moving slowly. Weight loss, you're losing weight because you're eating less. And excessive guilt. This is very typical that this patient have guilt against themselves. So more than 4 symptoms. Check the symptoms out and find 4 symptoms, and then you have a DSM criteria of melancholic depression. Mixed features is when we can mix different types, and it means that we have at least 3 manic or hypomanic symptoms. So mixed does not mean that we are mixing the different subtypes what we talked about until now. It just means that we are mixing actually manic or hypomanic symptoms together with depression, because usually we call this disease unipolar depression. That means we have only depression. When we call it bipolar, we mean that we have depression and manic episodes also. But in order to classify bipolar disease, we need more manic episodes than in this mixed type. So the difference between mixed depression and bipolar disease is just the level of hypomanic or manic symptoms. In mixed depression, we have fewer of them. In bipolar, we have a lot of them. So it means we have a lot of manic behavior and we have a lot of depression. So we have both of them. And therefore it's called bipolar, because we have two poles of this personality. Either he's so happy and so aggressive and so upbeat and so productive, that's this manic behavior, or he's very depressed, he's doing nothing, and so on. Bipolar. So the same personality can be either very high achieving or very low achieving. But in mixed features, we have the same, but the scale is a little bit smaller. Okay? So at least three symptoms, and to differentiate between mania and hypomania, we have to understand that hypo means less of something, hypo. That means that we have less of mania, okay? That means that, for example, a hypomanic person would say, look in the mirror and say, oh, I'm so good looking, I'm so good, and so on. But the manic person would think further, he would think, no, I'm God, or I'm the king, okay? This is the difference. Examples can be that inflated self-esteem is there in hypomanic persons, but there's no delusional grandiosity. Delusional grandiosity means that I think I'm the king, but actually I'm not, okay? I'm far away from being a king, and therefore I'm delusional if I'm thinking I'm a king. But inflated self-esteem is just saying that I'm looking good today, and that's not a delusion. You can look good today, but it's a little bit inflated. Maybe you think you're looking better than you actually are, okay? So inflated, this cat thinks that he's a lion. That would be inflated self-esteem, but I would not say that it's almost a delusion, yes, because the muscle power and everything from a lion is much, much higher, okay? So we can argue this is a delusional grandiosity for a cat. Flight of ideas, but more organized, meaning a hypomanic person can still organize his thoughts and his ideas, but a manic person is completely disorganized. He is having this flight of ideas with the grandiosity, delusions, and he cannot organize these thoughts. Thinking quick and creative compared to racing thoughts that are disconnected. So mania is racing thoughts that are disconnected, disorganized flight of ideas. In hypomania is more organized, can think quickly, but it's very creative and so on. It's not disconnected in any way. So a hypomanic person can achieve a lot in life, actually, and still be organized. Loud and rapid speech, but easier to interrupt. So it's very hard to interrupt a manic person, but it's easier to interrupt a hypomanic person. So he's still loud and he's still rapid in speech. Okay, hypomanic person. Improved social functioning in hypomanic person compared to impaired social functioning manic. So manic person is actually performing less in social circumstances. Mild risk-taking behavior. In mild risk-taking behavior, hypomanic, and very, very aggressive risk-taking behavior in manic persons. Manic are completely risk-taking persons. No psychotic symptoms in hypomanic symptoms. So no psychosis. In mania, we have psychosis. Almost never requires hospitalization. So in hospital, you will usually see manic persons and not hypomanic persons. Because as we said, hypomanic persons can still function good in social circumstances. They're more organized and so on. They have no psychosis. If you have psychosis, you will come to the hospital immediately. How common is a major depression with mixed features? How common do you think this is? So depressed people with mixed features of this other pole, which is the hypomanic and manic pole. 30%, very common. So we said that we have then 50% is having this anxiety part, anxiety depression, and 30% is actually having mixed features. So it's very, very common. This is a very common now. So we have 30% being mixed features, 50% being then anxiety type. The criteria, DSM criteria, is that we have to have more than 3 symptoms of elevated mood. We have inflated self-esteem. We have more talkative, so rapid speaking. We have flight of ideas, and we have increased energy. We have decreased need for sleep, and we have excessive pleasure activities like shopaholic or sexual addiction. So these people are really shopping a lot, they're buying a lot of stuff, and they are actually addicted to sex, or they are having a lot of sexual intercourse. So this was a depression with mixed features. 30%, remember that. And we needed more than 3 symptoms here. Peripartum is simple. You have a pregnancy, and during the pregnancy here, you can see that we have a depression only during the pregnancy, and then afterwards it's not. And it's actually within 4 weeks of childbirth also, so around 1 month, it's still there. So it starts in the pregnancy, and it can be there for about 1 month, and then it's called peripartum depression. And this is actually also very common. Not all women recognize it. They just feel a little bit empty. Okay, and there are of course females who feel so empty that they actually do something very scary, meaning they harm the child. So watch out. This is very, very important to recognize, because it's very dangerous. A little baby can get harmed by these females that are having this depression. So watch out if you are a husband, or if you are a relative to a woman that you see is having a depression. Psychotic features. These are delusions. Completely the reality is really strange for these people. They are thinking things that are not there. Hallucinations is actually that they are seeing and they are hearing things that are not there. So delusions is more thinking things that are not there. Hallucinations are more seeing it actually, or hearing something that is not there. Thought disorganization. The thoughts are completely disorganized. These people are agitated and aggressive. So therefore, these people will come to the hospital, usually because they are too aggressive, too agitated. They hear voices and they see things that are not there, and they think about things that are completely disorganized and not even there. This is a typical psychosis. And there exists a depression with psychosis. So psychotic depression. Seasonal. This is actually when, for example, the winter comes and the people start to get more depressed. This is very, very, very common, and actually it's not so dangerous in that sense that it's almost happening to all people. When the darkness comes, when the winter comes, people usually get a little bit more depressed. And this is a recurrent episode of depression occurring almost at the same time of the year. October, November, December. Okay? Quick review. Let's look at the review now, and we will go through this presentation very quickly. So the subtypes were anxiety, atypical, catatonic, melancholic, mixed feature, peripartum, psychotic, and seasonal. So anxiety types, we had these are worrying a lot. They have ruminative thoughts, thinking about the same things, having hypochondriac features, panic attacks, and hand wringing, and so on. Then we have the 50% being the statistic of the anxiety type, and that is the most common, I would say. The criteria being that we have to have more than 2 symptoms of tension, or restlessness, or impaired concentration, or fear of losing control. Then we have the atypical type. This is more like feeling better in positive events. They are sleeping a lot, they are eating a lot, they have heavy limbs, they are very sensitive to interpersonal rejection. It starts at the earlier age, and we have a family history that we can trace back to your mother or your father or your grandfather. And then we have substance abuse, alcohol being being there. Suicide attempts in atypical depression, personality disorders is very common, and anxiety. So it's a mix here, anxiety. The criteria, we have to have at least 3 symptoms of feeling good in positive events, increased appetite and weight gain. We have to have hypersomnia with more than 10 hours of sleep per day. We have heavy limbs, and we have anger and slightest rejection from others. Okay, more than 3 symptoms. Catatonic is this very strange person. He's moving very slowly, or he's not moving at all, or he's not talking, or he is almost in an unconscious state, a very stupor state. He is very negative, waxy flexibility, meaning that the position is staying where you put the patient in, and posturing, meaning also that they make this different postures than normal people do. Then we have excessive purposeless muscle activity, like this tap, tap, tap. It has no function, but these people do it anyway. They are staring at you. They are talking the same things, that they are repeating what you say. They are actually repeating what you are doing. And then we have melancholic. Melancholic is the one maybe you know, unresponsive to improved circumstances. It doesn't matter what these people have around them. They are completely neutral. Anhedonia, they are not happier with friends, or they are not feeling any pleasure anymore. Psychomotor agitation or retardation, so they are either very highly repetitive in their movements, or they are very slow. Cognitive impairment, meaning that they are not concentrating enough, they are not memorizing enough. Interrupted sleep, meaning that they don't sleep so much as, for example, we have in the opposite, as we said in atypical one. Here we sleep more than 10 hours. In these cases, maybe we only sleep 6 hours. Loss of appetite, so eating less. And diurnal variation, meaning that you are more melancholic, more sad during the evening. Then we have these being most commonly there in severely ill patients and with psychotic features. So melancholic can be more common with psychotic features. The criteria for melancholic depression when we're dealing with the DSM criteria is that we have to have at least 4 symptoms of loss of pleasure, don't feel better in positive events, severely depressed mood with gloominess, so listening to music that is very sad. Early morning awakening, so they wake up, as we said, after 5 hours of sleep, for example. Psychomotor retardation or agitation, so either very too fast or too slow in their movement. Weight loss, since they eat less. And then we have excessive guilt is there for melancholic depression. More than 4 symptoms we need to have. Mixed features is when we have a mixed features of maniac, so the other pole of this disease. So it's a unipolar disease, but we have mixed feature with some other part, which is this manic or hypomanic symptoms. And this is very similar. Hypomania, mania is only different in the degree of the symptoms. So hypomanic on the left side and manic on the right side. Manic, as we said, have completely delusions of himself. He thinks that he's more than he actually is. Hypomanic is inflated self-esteem, but there's no delusion of grandiosity. Inflated self-esteem, but no delusion of grandiosity. There's flight of ideas, but more organized. He's thinking quick and creative compared to racing thoughts that are disconnected in manic type. He's loud and rapid, but it's easier to interrupt him. Improved social functioning compared to impaired social functioning in manic type. There's mild risk-taking behavior compared to severe and high risk-taking behavior in manic type. There's no psychotic symptoms, and we know psychotic symptoms are delusions, hallucinations, and these ones. Almost never requires hospitalization, meaning manic types are usually in the hospital, but hypomanic are not. So 30% is somehow related to mixed features. So it's very, very common, together with this anxious type, which is 50%. The criteria of mixed depression is actually not a full criteria of mania and hypomania with more than 3 symptoms. So you need to have 3 symptoms, but it's not the full criteria of mania and hypomania. We will do a video explaining that one. So it's elevated mood, or it's inflated self-esteem, or it's more talkative, as you said. It's flight of ideas, it's increased energy, decreased need of sleep, and excessive pleasure activities like shopaholics or sexual addiction. Okay, peripartum, this is happening during pregnancy and can actually be there for about 4 weeks or 1 month after the childbirth. Then we have psychotic features. This was delusions, hallucinations. We have thought disorganization, agitation, and aggression. So whenever you see these people, then you know it's probably a psychosis, and we need to treat these patients in the hospital. So seasonal, this is very common, happening during seasons, meaning, for example, when the winter comes and it's recurrent, so every winter this patient have a seasonal depression. So I think that's enough. So as you saw, this is very similar to the video I made with symptoms, but here I highlighted more the different subtypes. In the symptoms video, I talked a little bit more about other things, also about other symptoms, and I wanted you to just have a video here showing the different subtypes, and then you can memorize this, and whenever the doctor talks about depression, and then you can know that he's talking about a psychotic type, or atypical type, or melancholic type, and anxious type. Then you know what he's talking about. Look at this video, and then you will see what this means. And if you take this classification, you can actually classify yourself. And when you have classified yourself, you can, of course, go to the doctor, and then you can talk with the doctor about how you should treat this disease. So I thank you very much for listening, and it was a very interesting video, I think, because we are looking at different shades of depression, so a different perspective, a different spectrum of the disease. Thank you very much, and have a nice day.